Hello everyone and welcome to set 7 of the part 1 questions. Let's get going. First question here, in which phase of meiosis is a primary oocyte arrested until just prior to ovulation? And then in which phase of meiosis is an oocyte arrested until fertilization? So first one here, in which phase of meiosis is a primary oocyte arrested until just prior to ovulations? So primary oocytes stay in meiosis 1, arrested in prophase for years until actual ovulation. Next part here, in which phase of meiosis is an oocyte arrested until fertilization? So an oocyte is arrested in the metaphase of meiosis 2 until fertilization, and this is a secondary oocyte, and the secondary oocyte degenerates if it's not fertilized. Next question, in performing a lumbar puncture to obtain a sample of CSF, what structures are pierced starting with the most exterior? So first you have the skin and the superficial fascia, and then you have some ligaments. So you have the supraspinous, the interspinous, and the ligamentum flavum. Then you have the epidural space, and then you have the dura mater, the subdural space, which is going to get you to the arachnoid matter, and then that's going to finally get you to the subarachnoid space, and that's where you're going to find your CSF. Next question. A 65-year-old woman with COPD is in severe respiratory distress, has cyanosis and signs of right-sided heart failure. What medications are used in the treatment of pulmonary hypertension? What is its mechanism of action? So this patient has cor pulmonale, or that right-sided heart failure resulting from COPD-induced pulmonary hypertension. So there are 4 main drugs that I want you to know for the treatment of pulmonary hypertension. So first you have the endothelin 1 receptor antagonist, so bosentan and ambrisentan. Then you have the prostaglandin drugs, which cause vasodilation, such as iloprost and epoprostenol. All of these prostaglandin drugs have prost in the name. Then you have the cGMP phosphodiesterase inhibitors, such as vardenafil, tadalafil, sildenafil. We more often associate these medications with the treatment of erectile dysfunction. And then you have the dihydropyridine calcium channel blockers such as nifedipine. Now all of these agents cause vasodilation, which will help with that counteracting that excessive vasoconstriction of the pulmonary circulation seen in pulmonary hypertension. Next question. Does the notochord become the neural tube? So this is one that you probably had to go through in anatomy. So the answer is no, so don't get fooled by the name here. The notochord is derived from mesoderm. It's important in the neural tube development because it induces the ectoderm that overlies it to become the neural plate. Now the neural plate gives rise to the neural tube as well as the neural crest cells. And of course, taking folic acid helps prevent neural tube defects. Next. From where does the amygdala receive inputs? Where does it send outputs? All right, so the amygdala receives inputs from all parts of the limbic cortex as well as from the neocortex of the parietal, temporal, and occipital lobes, especially from the auditory and visual association areas. Now the amygdala transmits signals back to the cortical areas from which it received inputs, the hippocampus, which is responsible for memory, the septum, also the thalamus, and also the hypothalamus. Next question. A 35-year-old man develops hallucinations just before sleep, episodes of excessive sleepiness, and cataplexy during times of laughter and sadness. Narcoleptic sleep episodes begin with what stage of sleep? What are the different stages of normal sleep, and how do they differ from one another? So first part here, narcoleptic sleep episodes begin with what stage? That's going to be with REM. You can rapidly go from the wake stage to the REM sleep stage. Now, what are the different stages of normal sleep? This will help us as well. How do they differ from one another? Let's go through these, talk about the waveforms. So you need to know the waveforms on EEG that you're going to see with each one of these stages. So in the awake state, you're alert, you see things like beta waves on that EEG. These are high frequency, low amplitude waves. Then when you're still awake but really relaxed, eyes closed, about to fall asleep, then you see something called alpha waves. And then we get into the actual stages. Stage N1 sleep, and the N actually stands for non-REM sleep. So N1 is light sleep. You see theta waves. In stage N2, which is a deeper sleep, you start to see what we call sleep spindles and K-complexes on the EEG. Now during this phase of sleep, you might also want to remember that you see bruxism. And what is bruxism? That's teeth grinding. Stage N3 is the deepest non-REM sleep, sometimes called slow wave sleep because on the EEG you see low frequency, high amplitude waves, and these are called delta waves. Now during this phase of sleep you commonly are going to see sleepwalking, you're going to see night terrors, and bedwetting. And then next we have the REM sleep, which is where you're actually dreaming. And you see things like beta waves again. So the brain waves in REM sleep is going to look a lot like the awake state. So you have increased oxygen consumption in your brain as well. Now, interestingly, your motor control is shut off, so you aren't acting out your dreams. So things like sleepwalking, they're not going to happen in your REM sleep. They're going to actually occur in that deep stage N3 sleep. Moving on, next question. The body uses both the cell-mediated and the humoral immune response to fight infection. Which T cell type regulates the humoral response? So T helper 2 cells augment the humoral or plasma cell response specifically by generating IL-4 and IL-5 cytokines, and that promotes the growth and differentiation of B cells. Now, T helper 1 cells augment the cell-mediated or cytotoxic T cell response by generating IL-2 and interferon gamma. Next, what are some of the reasons a woman might have primary amenorrhea? So that's a really broad question. So primary amenorrhea is when a woman isn't menstruating and she's never ever started menstruating, never had a period. Now if she had normal menses previously and then stopped, we call that secondary amenorrhea, so don't get that confused. Now some of the most common causes of primary amenorrhea, never had a period, think of Turner syndrome, imperforate hymen, androgen insensitivity syndrome, Mullerian duct agenesis, and delayed puberty. Next question. What is a syringomyelia? What symptoms are so commonly seen in patients with syringomyelia? So what is a syringomyelia? So a syringomyelia is a cystic enlargement of the central canal of the spinal cord, and that dilated canal can compress the tracts right around the canal, especially the crossing fibers of the spinal thalamic tract in the anterior white commissure. So if that syrinx is really, really bad, it can actually involve the motor neurons of the anterior horn as well. So then what symptoms are we commonly seeing in this situation? So you're going to get loss of pain and temperature sensation in the upper extremities while sensation to touch is unaffected. And the deficits are typically in sort of a cape-like distribution. So it's as though you've got a cape draped over your shoulders. And then if those anterior horn cells are compressed as well by the syrinx, you could also see some motor deficits. So you can also see some things like hand and arm weakness. Next question. Coal miners are at an increased risk of skin cancer because of their exposure to arsenic. What type of skin cancer is associated with this exposure? So this is going to be squamous cell carcinoma. All right, guys, so we've come to the end of our set number 7. I hope you learned something. I'll see you next time.